This presentation has to do with Dr. John Stewart, who is a very important person in the history of medicine in Nova Scotia, especially during the last half of the 19th century and the early part of the 20th century. He was Dean of the Faculty of Medicine at Dalhousie from 1919 to 1932. And one of his great friends and mentor was Joseph Lister, who became Lord Lister and who introduced antiseptic surgery into surgery, an extremely important event during the history of medicine. Now, John Stewart was born in Black River, Richmond County, Cape Breton, and you'll notice it here on the map, Cape Breton Island. There's a red star at Rear Black River where he was born. His father was a Presbyterian minister there, and his father and his parents actually promoted education among their children. And so John was eventually sent to Truro to the Normal College to become a school teacher. So he's born in Black River in 1848. He's the oldest of 10 children, 5 boys and 5 girls. And it's quite surprising. You can imagine having 10 children in the early 1840s, 50s, 60s, and in Black River, Cape Breton, which was really quite isolated at the time, but 9 of these out of the 10 went off to university, indicating that the parents were extremely promoting education among their children. So he attended the model school in Truro, which was really a high school, and then he studied for 2 terms at the Provincial Normal College in Truro, graduating with a first-class license. He then went back to Black River and later in Sydney to teach school. Now, I expect he would have been a great teacher in school. However, there was a call came to him from Aberdeenshire, Scotland, where his mother's family had a very, very large farm, and the father of the family had died, so his widow, who was John's grandmother, needed help. So John went over to Scotland to help on the family farm, actually to sort of manage it for his grandmother. He was there from 68 to 71. In 1871, he decided to go to Edinburgh University, and he spent a year there studying classics, again showing his great interest and training in education. He changed his mind, though, as to the area he was going to study, and he came back to Halifax, and he entered Dalhousie Medical School to study medicine. And he was here at Dalhousie for 2 years studying medicine. However, in 1875, there was a major problem with respect to the medical school, in that the faculty in the medical school decided to incorporate and set up their own medical college called the Halifax Medical College. So John Stewart decided that he would not continue on studying medicine in Halifax, and he would go back to Edinburgh to continue his medical studies there. So here he is in 1875 as a medical student at Edinburgh. And if you look at this photograph, which are students in Edinburgh at the time, you see John Stewart in the back row, the third from the left. Handsome looking man, and he spent the rest of his medical training in Edinburgh, studying under the supervision of Dr. Joseph Lister. And he eventually became Lord Lister's house surgeon. Now, while he was at Edinburgh, I was able to obtain a list of the courses he took and comments from the professors and from the University of Edinburgh, and you're looking at them now, and you'll see Dr. Lister's name there in various places. First of all, he was Lister's dresser. A dresser really was a student who actually performed putting the dressings on the patient after the operation, the various necessary dressings that were required. Then in 1876, he became the clinical clerk, which meant that he had more responsibility during the operation under his mentor, Dr. Lister. And then finally he got the sort of the top job for a student, and that was house surgeon. And that meant that he actually lived in the hospital for the year, and he was in charge of the patients at night and assisted the surgeons during the day in the surgery. This is Sir Joseph Lister on the right. He is probably the most famous person in the late 18th century in medicine in the world because, of course, he introduced antiseptic surgery. Before he introduced antiseptic surgery, there was a very high infection rate after performing surgery. In fact, his infection rate at the University of Edinburgh before he introduced antiseptic surgery was 40%. That meant that 40% of the patients he operated on came down with infection. And if you walked into his ward prior to the introduction of antiseptic surgery, the stench was almost impossible to deal with because of the rotting flesh due to the infection of the patients. So this really bothered him, as it did probably other surgeons, but he decided to do something about it. And so one day he was walking in the garden outside the University of Edinburgh with a chemistry professor, and he asked the chemistry professor, "What can I possibly do to try to prevent the infection of the wounds that I create when I do surgery?" And the chemistry professor said, well, there is a substance that you could use, but it's quite toxic and it will kill the infection. However, you have to be very careful with it because it can also kill healthy tissue. So it's very important to apply it in a way that doesn't cause destruction of healthy tissue. So Lister decided to try it. What it was carbolic acid, which is a solution, a liquid that comes from creosote, and it is toxic and it has quite a smell. Anyway, he introduced it, and lo and behold, over a period of 6 months, his infection rate went down from 40% down to 2%. Now, John Stewart was there all the time assisting Lister during this period, and of course he was absolutely convinced that this was the way to go with respect to surgery, to use an antiseptic. And so he did learn a great deal from the person who invented it. And this, of course, had quite an impact on Nova Scotia with respect to surgery in Nova Scotia once John Stewart returned to this province, which he did after 1878. And he brought antiseptic surgery into Nova Scotia and promoted it all over the province. He would go around the province and give lectures on antiseptic surgery and demonstrate it. And this, of course, meant a great deal to the survival of surgery patients in Nova Scotia. Now, it turns out that he was not the only one that was really watching what was going on in Edinburgh. It turns out that there were some very proactive doctors in Nova Scotia at the time. Dr. A.P. Reid was one. Dr. Edward Farrell was another. And they set up the Clinical Society of Halifax in 1869. That's 2 years after Lister came up with the idea of antiseptic surgery. I discovered the minutes of that society in the archives about 10 or 15 years ago, and in the minutes on October the 27th, 1869, this group, chaired by Dr. Reid, had a special meeting on carbolic acid. A number of the members said that they had already started to try it, and they were having certain degrees of success. Now, of course, the important thing, it's the same thing in most things in medicine. You have to be using the right dosage and the right method of administering it, so not everyone had success at first. It was only after John Stewart arrived back in Nova Scotia and brought a carbolic spray unit with him that he showed the surgeons here how to properly use it. So when he comes back to Nova Scotia, surprisingly, he didn't set up initially an office in Halifax. He went to Pictou. And the reason he went to Pictou is because his aged parents had moved from Black River to Pictou to retire, and they were not in good health. So he went to Pictou and set up an office there in the town of Pictou. And he was there for the best part of 20 years. And was really one of the founders of the first hospital in Pictou, the Pictou Cottage Hospital. In 1896, he decided that he would come to Halifax, and in 1898, he purchased this house on South Street. If you go down the hill on South Street towards Barrington, this house still stands there. It's a brick house. And this was the house that he lived in with his sisters and his mother. He never married, so he was living there with his relatives in this house, and he had his office within this house. And he lived there until 1933 when he died. And I was able to find the floor plan of his house on South Street, and it does show he had a laboratory there and a consulting room. And the first floor, part of the first floor, was pretty well dedicated to his office and his waiting room for patients and so on and so on. So he was quite a busy surgeon. In fact, in 1910, when the Premier of Nova Scotia discovered that he had gangrene in one of his legs, he went to see John Stewart, and John Stewart convinced the Premier that unfortunately that leg had to be removed because of the gangrene was causing tremendous deterioration in the flesh in that leg. So they met at the VG Hospital in May of 1910, and Dr. John Stewart amputated the right leg of the Premier George Murray. Surprisingly enough, Premier George Murray, after he had his leg amputated, he decided to continue on as Premier. He still had time left in his mandate. He went off to Chicago in September of 1910 and had an artificial leg fitted, and came back and continued on as Premier, and was re-elected a couple of times until 1923. So for 13 years, he continued on with a prosthesis, an artificial leg, which is really quite remarkable when you think of it. Other people have done this, of course. We know that Franklin D. Roosevelt was very much an invalid for quite a bit of the time when he was President of the United States, and in fact couldn't stand up unless he had support. So it's something that people do if they really want to continue on with what they were previously doing, and that was the case for Premier George Murray. Now, that wasn't the end of John Stewart's career by any means. In 1915, Dalhousie University decided that they were going to send a hospital over to France to be part of the hospital system for the First World War for the Canadian Army. So they were looking around trying to decide, well, who's going to be in charge of this? And they picked John Stewart because of his reputation, because of the fact that he had built up such a practice and was highly regarded as a surgeon, and they picked him. He was also a single man, so it was a little easier for him to do this than if he had married and had a family. But anyway, he became the colonel in charge of what's called the No. 7 Stationary Hospital, which was Dalhousie's contribution to the First World War. And you see him here sitting in front of his tent in France, and it was at a place called Arcus, A-R-Q-U-E-S, France. And he was there until late 1918, early 1919. Survived the war. A number 7 stationary hospital was bombed at one time, and his 2IC, Dr. Hogan, was injured, but Dr. Stewart managed to survive without injuries. So his legacy, and it's a major one, during his time in Halifax on South Street, he was elected the president of the Canadian Medical Association in 1905. When he came back after the war, he realized that Dalhousie's Faculty of Medicine was not very rich with researchers. There were very few people doing research at the university. So he made it a point to try to attract well-known researchers in the world to Dalhousie so that we could increase here our depth of research being undertaken. As I said before, he also promoted antiseptic surgical procedures throughout North America. In fact, he went to the United States to try to convince them. They were very hesitant about adopting antiseptic surgery, and he was trying to convince them, especially the United States, to do so, and they finally did. So he modernized Dalhousie's faculty by hiring physicians and basic scientists with PhDs and doctorates of science, so that both basic and clinical medical research could be pursued. And he was quite active in publishing. He published over 50 papers on his surgical discipline. So he is remembered as one of the most important, probably the most important person in the history of Dalhousie Medical School. And even today, everybody knows of who John Stewart was. At least the members of the Faculty of Medicine, they know who he was and what he had done, and it's a great pleasure to provide you with an opportunity to find out quite a bit about his life and career. Thank you very much.